And our third headline this morning, COVID reinfections on the rise. All of this coming as many parts of the country are reporting a fourth surge. Also, some Georgia hospitals tell us they're still seeing a large number of COVID hospitalizations and people getting infected with the virus for a second time. And that is our top story this morning. Joe Ripley tracking the new developments. He's live in Atlanta with a closer look at what may be driving up the numbers. Joe, what are health experts saying about the rise of infections and reinfections?
Good morning, Sheba. Dr. Danny Brandstetter with Wellstar Health System attributed the uptick in hospitalizations to warmer weather, people going on spring break, even some letting their guards down because vaccinations are also on the rise. But data from the Georgia Department of Public Health shows over the last week more patients have been admitted for hospital care due to COVID-19. Specifically, at least two regions in the state are seeing increases. Northwest Georgia along the Tennessee state line and the area including Cobb, Douglas, Paulding, and Cherokee counties. Dr. Brandstetter says COVID patients coming into hospitals in the Wellstar Health System have plateaued rather than decreased, with some of them battling the virus for a second time.
Our antibodies that we make either to vaccine or as we recover from the actual infection are not 100% protective from getting this again.
The CDC says that reported cases of reinfection are extremely rare, and if someone does get the virus a second time, it's likely they get one of those strains, variant strains rather, of COVID-19.
And Joe, how does Georgia track reinfection rates?
Well, experts with the Georgia Department of Public Health are saying it's very difficult to track that, Sheba, because you have two different strains of COVID-19 potentially, plus they would have to compare the first round of infection with the second round of infection, and that's very hard for them to do. But experts are reminding you this morning to continue to take measures to prevent the spread of COVID-19, including washing your hands, wearing a mask, and social distancing.
All right, Joe Ripley, thank you.